About 8,000 people die annually from tobacco-related illnesses in the country, according to the statistics released by the Harm Reduction Society of Kenya. The society wants policymakers to come up with new regulations on tobacco control and novel products. While launching a campaign on safer alternatives, Harm Reduction Society of Kenya Secretary General Michael Kariuki urged policymakers to reconsider policies that prevent smokers from accessing alternatives that would help them quit the habit. According to the World Health Organization, tobacco use is the leading preventable cause of death in the world.
One of the key things we should focus on is preventive medicine. For us to prevent burdening the new insurance scheme with non-communicable diseases, we must look at controlling the effects of tobacco. And how to control the effects of tobacco is through embracing safer alternatives. Letting the smoker know that if you have tried willingly and you didn't succeed, you can get help. You can get help using safer alternatives. If you don't smoke, you should never use safer alternatives. And the message should be clear out there, because they are not risk-free. They are less risky than the cigarette, but they are not risk-free.
Significant conclusion to be remembered surely must be this. For people who are struggling to quit smoking, tobacco-free nicotine products can save their lives. So the best thing Kenyan policymakers can do is to base their regulations on science. Attempts to bully them into ineffective, deadly prohibition must be rejected. Instead, tobacco harm reduction should be integrated into the public health strategy via risk proportionate regulation. If smokers can't or won't quit, we need to help them switch to safer alternatives.
Regulation of these products is, of course, necessary, more so to protect our young people and youth. I did say that I'm a pediatrician, and I can tell you for sure the brain of a child will stop growing at the age of 24 or 25 years. The moment that person is introduced to some of these substances, before that, they get hooked, and it becomes extremely difficult to unhook them from the product. So we must protect our youth and the young. We did see recently that NACADA did release a report that the tobacco initiation age in this country is shockingly at 6 years of age. Those are NACADA statistics, and we can see where this is coming from. The father who is sitting back at home is sending their young son to buy cigarettes. The father who is assisting at home or sitting back at home, or the mother who is back at home, is smoking cigarettes, even while pregnant, is smoking cigarettes in the presence of these children. And you can imagine what dangers that will have at the household level.